Hi, I'm Dr. Ryan Stratford at the Women's Center. Today I'm going to talk a little bit about the importance of both preoperative and postoperative preparation for treatment of pelvic organ prolapse. We've talked before about how you can have pelvic organs falling down. That's called prolapse. Surgical treatment can be very effective, but what is often missed is the importance of preparing for surgery and postoperative management of their pelvic floor muscles after surgery. Let me show you a little bit about this. So if you look at this diagram, which I've shown before, you can see how the bladder, vagina, rectum, and uterus are all in very close proximity. The structural supports to the vagina have a significant impact on the rectum and the bladder. If there is support breakdown because of childbirth injury and tearing of some of those ligament supports, there will be movement like this, and that condition is called prolapse, or a bladder that's fallen. The same condition can occur on the back wall of the vagina, causing the rectum to bulge through and making it difficult to pass stool. These conditions can be repaired surgically. The surgery can be done using the native tissue that's in this area, reconstructing that tissue and rebuilding its supports to the ligaments that come off the bony pelvis will provide excellent support. But what is often forgotten are the important muscles that are within the pelvis. These muscles here that create a bowl of support. Those muscles also support the whole pelvis. It's sort of akin to a boat going through the Panama Canal. I love this analogy. The cables that hold the boat in place so it doesn't slosh up and hit the sides of the canal are very important, and they provide a lot of support. But it's the water that gives buoyancy to the boat. Without this water, the amount of stress and pressure on those cables is very excessive. Similar to the pelvic floor muscles in the pelvis, the water supports constantly all of the activities that we incur putting pressure on our pelvis. If those muscles are not very functional, then the amount of stress on the cables, the structural tissue that holds the vagina and other structures in place becomes a lot greater, and it can cause tears and injury. So not only are the muscles important to protect against injury, but also once prolapse has been repaired, in order to reduce the chance of that prolapse recurring, it's important to strengthen those muscles. That's why about 50% of the patients that I see for pelvic organ prolapse will need to have pelvic floor physical therapy. There are specialists in physical therapy who are specially trained in helping women to learn how to recover and strengthen the muscles in their pelvis. It's a whole group of muscles that are critical to reducing risk of future injury, as well as to give normal function to their bladder and bowel. This is a significant part of how we help people manage conditions with pelvic organ prolapse. If you have further questions, I'd love to have you come visit with me or visit our website at thewomenscenter.com.